Hi everyone, my name is Dr. Igor and I am a clinical oncologist practicing since 2010. Today I'm going to tell you about the Beers criteria. These are made to minimize the risks for elderly who take lots of medications. Because sometimes some medications may do more harm than benefit for elderly. What are these medications? Let's figure out. Inappropriate prescribing of many medications, the list is more than 50, for elderly may have very huge risks because of lower efficacy and higher side effects. First of all, these are alpha blockers. These block alpha adrenergic receptors and relax smooth muscles. Some of them are used for hypertension, but the most famous are the medications to treat the benign prostatic hyperplasia, when the prostate is enlarged and it squeezes urethra and the urine flow is decreased. So old men are often prescribed these medications. The problem is they increase the risk of hypotension, so low blood pressure drops, because when the person stands up, he has to increase his vessel tone, so the blood pressure will increase, not fall down. And if it doesn't happen, the patient stands up and his blood pressure falls down because the receptors are blocked, and they get this fall in blood pressure and they get their loss of consciousness. So there is a high risk of falls, of fractures, of head trauma, etc. The medications against urinary incontinence, the medications against depression, antidepressants, they increase risk of sedation, of delirium, of falls, of constipation and urinary retention. The same can be said about benzodiazepines, that are sedatives, and some people use them to improve their sleep. Non-steroidal anti-inflammatory drugs, something that is often used for pain, for high temperature, to decrease inflammation. If you use them chronically, they may cause gastric ulcers and bleeding into gastrointestinal tract, especially because many elderly, they use the anticoagulation to decrease the risk of blood clots. And together this can lead to very bad bleeding. And also want to tell you about the proton pump inhibitors like Omeprazole. They decrease the production of stomach acid and decrease the barrier for bacteria. So this may lead to a very bad bacterial disbalance, and even their Clostridium overgrows with their subsequent bad gut damage and severe diarrhea. And the person can even die from dehydration. That's why it's very important to have the individual approach to every patient and to prescribe only if the patient really needs the medication, and to always tell about the possible side effects and start from the smaller doses, gradually increasing the dose to reach the most effective and least dangerous for the particular person. Dear friends, that's it for today. I hope it was interesting for you. Good luck. Bye-bye.